So I recently lost my mother due to heart failure, heart attack. It's not even a week, it's just 3-4 days. And I just want to share a message, a request to the medical professionals, to the hospitals, to be more empathetic towards your patients. I know that doctors are not magicians. I know that all the medicines cannot always guarantee that the patient would be healed. But in the tough times, the relatives or the close ones, all they want is someone to listen, someone to understand, someone to be there and just tell us what is exactly happening. Not someone who just I got my mother admitted to Jahangir Hospital in Pune, and she was under the guidance of Dr. Ritu Bhatia. She's a famous cardiologist, and my mother was associated with this doctor for almost 3-4 months now. I am not questioning anyone's degree or medical knowledge or experience. All I am saying that when I called the doctor in the time of emergency, the statement was not what happened, tell me. The statement was, why did you not contact the clinic first? This is not the kind of response that anyone would like to hear. This shows how much lack of empathy a doctor has towards their own patient. And even when my mother was admitted in the hospital, she did not care to come once to see her. Everything was left on a message, on a call to the junior resident doctors. This is not the kind of professionalism that you show with respect to your patient. She was critical, you knew she was critical. I'm not saying that you would have saved her, but I am saying that she should have been there. She should have came to the hospital to see, not direct the junior residents to take care of such a critically ill patient. Where is our empathy going? Doctors needs to be practical. I know that they cannot be emotional for every patient, but that does not mean that you will not be sympathetic towards your own patients. You need to understand not only the patient but also the family, the close ones, somebody's daughter, someone's son, someone's husband, someone's mother, someone's father. It's not a joke. Our parents' life or our close one life is not a joke. The family of the patients are not stupid. This doctor is extremely rude, extremely arrogant. You are not supposed to be arrogant or rude as a doctor. It's an empathetic profession, and you have to show remorse for the people who are facing problems health wise. If you have to leave everything on junior resident doctors, what is the point of having senior doctors in the hospital if resident doctors can do everything? It's extremely unprofessional, extremely unprofessional. I am heartfully disappointed with whatever happened. Patients, their family, they are not stupid. They are not calling you out of just for talking. They are calling you out of emergency. And similar is the case with the hospital, Jahangir Hospital, in which she was admitted. There is no facility for a person, for the family members of the patient who are in the ICU. You cannot sit on the stairs. The doctors will scold you. No matter how old are you, how young are you, the security will talk extremely rude with you, like you are some kind of uthaya gira from somewhere जिसकी कोई इज्जत नहीं है. Even a poor person deserves respect. And on the top of it, there is not even a waiting room. How can you expect the family to just go away from out of the hospital and your patient is inside the ICU? Doesn't make sense.